Hi, my name is Dr. Chris Steidinger. This is workout number 7. This is hip mobility. This is going to be a slightly different format than the previous 6 workouts. With a focus on this is just going to be increasing our range of motion, increasing our mobility in our hip. It's not as much as a challenging workout. It is more mobility workout. So we're going to warm up a little differently for this. We're going to warm up doing modified squats. And we're going to try to go lower and lower each time, and then we'll also explain to you the squat test. So we're going to warm up by just slowly going back. Now, to properly do a squat, you want your feet a little bit wider than your shoulders. You want your feet angled out at around 35-40 degrees, not totally 45, but about 35-40 degrees. And when you go down, you want your knees to track out over your feet. You want to throw your butt back, core tight, and you just want to start going lower and lower. Each time go a little lower. Put your arms up for balance, and eventually you want to go as low as you can go. All right, the squat test is to be able to just go all the way down to your heels while lifting your toes off the ground. That's going to be very difficult for some people to do, and that's the squat test. If you can't go all the way down and take your toes off the ground, you have hip mobility issues, and you could have ankle mobility issues. And I have stretches online for feet and for ankles, which are worth doing. But this workout is about increasing hip mobility. And most people have tight hip flexors, tight hips. So this is the routine for them. So the first part, you want to go as close to the wall as you can go. We're going to stretch our right hip out first. I'm going to start the timer. So I have my foot kind of in a figure 4. Now I'm kind of pushing down. And I'm just kind of rolling to the left. Roll into the right. Wherever you feel a really tight spot, spend more time on that. Really, you want to feel the tightness whenever you're stretching. So I'm really rolling to the left, rolling to the right, pushing down. I'm really, really tight right there, so I'm spend a few extra seconds there. Now, so that's 30 seconds. Now we're going to pull up. So I'm going to roll back to the left, pulling up, and you'll see it's a completely different feeling and hits a completely different area of your hip. And I'm pulling up this time. Previously I was pushing down. Right there I'm pretty tight, so I'm going to spend a little bit more time there. I'm going to keep rolling. I'm going to be doing this for another 5 seconds, and I'm going to switch sides. Okay, that's about a minute on that leg. We're going to switch. Now, we're pushing down as we roll through a range of motion. Seconds extra wherever you have your tightest spot. Okay, so that's 30 seconds of pushing down. Now I'm going to do 30 seconds of pulling up. Now, if you have pain or discomfort, just back off. Take your time. Take your time working that in. You can even pull higher too, that'll give you a slightly different effect. I'm really tight there, and most people will be. Okay, that was a minute on the wall. Now we're going to come back out into that hip position right here. We just want to basically put our hands out as wide as our knees, and you just kind of want to lean forward and to the right. That's really, really stretching the inside of my right hip. If you want to sit up a little higher in your stance, you'll feel it stretch your ankle, and that's a worthwhile stretch if you have ankle tightness. But here, I'm just focusing my right hip. Okay, that was about 30 seconds on that side. We're going to switch over to here. And really just putting my hand down on the floor like that. I'm leaning forward like that. You can do it both simultaneously. Really lean forward. Wouldn't recommend that at first. That's a pretty intense stretch. And you can kind of rock from side to side. That's really pulling that side. Okay, that was about a minute of that. Now we're going to stretch our hip flexor, the front of the hip here. That runs from the front of your hip to your spine. And the best way to stretch that, you can do this laying down on the carpet, but really just want to elevate your leg on something, and you want to slide forward. You don't want to be in this position, or this position won't do anything. See, my hip is flexed, but here my hip is extended. I take my opposite hand, so I'm pushing my left hand through, this is my right hip, and then I'm kind of leaning away. That's a really, really intense stretch. You can kind of slide forward and back away, and you'll find a certain angle, really, really hit it. Hip flexor is just, it's a really long, powerful muscle. On most people, it's very, very, very tight and atrophied, so this can be somewhat intense. If you're a baseball fan, if you ever get to the games early, you'll see the players doing this type of stretch. Okay, I was doing it on that side. So I'm going to switch to the other side. Again, see how I slide forward? This hip is an extension. I'm pushing through with my opposite hand. So I'm stretching my left hip, but I'm pushing through with my right hand to lock my left hip in place. And I'm just leaning back and away. And right there it is. I just really want to hold that. And you want to try to lean back and away. You can adjust the angle of your upper body and your hip placement to make it more intense or less intense. You know, feel for the tense spot. Whenever you're stretching, always try to find the tension in the muscle or the ligament and kind of work it out. Okay, so that's it. That's our little hip mobility workout. If you do it right, you will feel your hips really, really open up. And then if you finish with the squat test again, you'll see it's much easier. It's much smoother. And especially if you struggle and you can't do that, doing that routine will allow you to improve that every time you do it. And it's something you can do every day or every other day if hip issues are something you have or you failed the squat test. Otherwise, just do that once a week, part of your normal cycle of exercises. All right, there you go. That's your 5-minute workout for the day. Thank you and have a great day.